good one. This is an older gentleman from Phoenix, Arizona. He passed out at home. He was at home by himself for a few days when they found him. And he has this huge sore on his back. He's lying on his back. So he took him to a nursing home. And at the nursing home, they were debriding him. But when the son went down there, he said, there's no progress in this. So he took him from the nursing home to O'Hare and drove him right to Peters the same day. So that's how he presented. Now this is a big hole, okay? If he goes to a wound center, it would take you guys months to debride it and months to close it. And we don't have time for that. So this is what this cleanup is right on the spine, right on the bone. And we gave him weights. Took me 2 hours to do this.
Beautiful.
I mean, Leslie helped me.
Beautiful.
It's all right.
I don't like to waste time. Okay. Oh, here's a good one. Okay, this case is a bad case. The doctor wound up not working out. So we did a robotic prostatectomy. Unfortunately, we cut the colon, the bladder, and you probably don't know Dr. Purcell's.
Don't say the word. Stop.
Every time, no, he's not Purcell. Every time he said, Jerry, come and help me, it's all bad. I don't get paid for deposition.
Stop it.
This is one of them. Anyways, we hang him up. We bring him multiple times. By that time, he was sick of Pecos Hospital. He wanted to go to the University of Chicago. At least we cleaned him up before he married. This is a hip joint. Okay, here's the perineum. Here's the anterior approach to the total hip. Okay? And when you need retention suture, it's not good. That means it's just way too tight. So this is only 2 to 3 weeks after the surgery, where they got all infected and a big hole. I can put my pen all the way in, and I'm trying to show the prosthesis right here. So when you get an infection like this, normally you have to take the prosthesis out, right? It's not good. But the surgeon said, no, it's only been there for a couple of weeks. Okay, he said no. So I made another plan. I took out the sartorius muscle. Bury it, fill the hole. What does a muscle flap do? It's really good. Muscle brings in blood supply, fills up the cavity, brings in leukocytes, and the antibiotics can get in there. So, fix it. Here's another back sore. It's not as big as the last one, but I did a different procedure. I took out part of the latissimus dorsi muscle here. The skin paddle is stuck in there. Look at what's available and try to fix it. Simple skin. Channel surgery. This thing has a ventral hernia that's been there for years. Multiple mesh been put in. Mesh, once they get infected, it's difficult. So it just won't close. So I went in, I took out the mesh. Hernia repair has changed a lot. I can spend a day talking about hernia, but it has changed a lot. In the old days, sorry guys, they put a mesh in hernia. But its recurrence rate is high. Now for these difficult hernias, we do the procedure called component separation. You know your abdominal muscle. You have the rectus muscle, external oblique, internal oblique, transversalis. We split them all apart and move them towards the middle. And in addition, I did one with Dr. Vascular recently. These muscles, because they've been contracted for so long, they're stiff and tight. They won't pull to the middle. So we put Botox in the muscles about a month before the surgery. We paralyze the muscle. Now we can advance everything closer to the knee. And for this case, sucker mesh, cut all the muscles on the side, slide a piece of pig skin underneath, additional compression, and close the muscle. I'm gonna move faster. This is a hysterectomy that went bad. I was gonna put another pig skin on. I love that pig skin. Okay, here's a vascular complication. He had a fem pump bypass. The skin died. And the graft is right underneath it. So you have to cover it, or there's no blood supply. This was, and so we divided it out. This is the graft, and that's a Doppler right here. We make sure that the pulse is going. And the surgeon was an older surgeon. He was very aggressive. He's scrubbing that thing with a brush and cleaning up. I was worried. I mean, if it starts to bleed, what are we going to do, right? So we cleaned it up, and we took the muscle and the skin from the side of his thigh, cleaned it to the middle, covered it. This is necrotizing Fournier's disease. Have you heard of that?
I can't.
Okay, so we came in, obese, diabetic, we breathed a couple of times to make sure everything is good. So this is what we're presenting. Now, in the old days, when your testicles are exposed, what do? You bury them underneath the thigh. What's the problem with that? That's a multiple stage operation. And the thigh is just too warm, the sperm cells will die. You're not going to have any more babies. So, and that's, I don't want to do that. So, I took out the gracilis muscles on each side of his thigh. Okay? You don't need a gracilis. And I wrapped them around each testicle. And then wrapped them up.
Oh, that was quick.
People leaving the restaurant.
Okay. I put this slide here for a reason. Before I talk about pressure, okay? Not every wound is caused by pressure. I sometimes have to defend nursing homes, okay?
Oh.
And if the wound is not on any bony prominences, hey, it's not a pressure sore. Okay? It could be from some other reason. And one of the reasons is this: it's called acute skin failure. And now skin is a big organ, okay? If the patient goes into shock, kidneys, everything goes into shock. So does the skin, and the skin dies. All right. So these are the criteria. And almost everybody has some. You go to ICU, they all have the same thing. Peripheral arterial disease, they've been on a ventilator for more than 72 hours, or they have history of respiratory failure, liver failure, and sepsis. So it's very easy to get this. So don't think every pressure sore is, or every wound. Pressure sore, I hate them. I'm talking just for completeness, okay? It's very costly to do this. Okay, just a couple of examples. This is an interesting case. There's a young guy worked for the city of Chicago. He was on some ladder, he fell and broke his neck. And he has these, because it's a workman's comp, the city treated him very good. He has 24 hours care and they pay for everything. Really good. So he has the bilateral hip pressure sores, trochanteric pressure sores, and we designed a flap on his thigh, the tensor fasciitis flap. Now, why did I bring this case up? I know him for a few months during the care. I never met his wife. His wife doesn't live with him. Never met his wife. He later died, and for some sepsis. And then I got a subpoena from his wife. They are suing the city for loss of companionship when she was never there. It's crazy. It's crazy. Anyway, we can fix them. I just don't like them. Here's another issue I just saw. We use a gluteus muscle flap. We're going to go to the extremities now. Young woman, 46-year-old, with a son, I think he's 13 or 14, heroin addict. Terrible. She would hide it all the time, and she injected this both arms are like that. Necrotic tendon infection. It's been going on for years. She's seen a dermatologist. They tried to treat it with enzymes. Just
Poison ivy, doctor. It's a poison ivy.
anyways, in the wrist area, it's difficult to find tissues to close. You cannot skin graft this, right? You have to clean up the tendons first. So, you have two arteries that goes in your hand. Radial artery and the ulnar artery is important. But we don't want to sacrifice the radial artery either, because if you take out one, you're going to get cold sensitivity. Every time you go outside in the winter, cold, and painful too. So we figure out another way. We designed a flap. We call it a perforator. The radial artery has multiple little vessels that comes out. We don't want to take out that artery. We will take that perforator along with the skin and along with the fat and the fascia. See, I lifted the skin up, find the fascia, there's a flap, and then transpose it anteriorly to cover up the wound. That's how it goes. So now she can carry on. Two separate operations because you can only do one hand.